Pneumococci are the normal inhabitants of the upper respiratory tract of 5 to 40% of humans and can cause the pneumonia, sinusitis, otitis, bronchitis, bacteremia, meningitis, and other infectious diseases. When it comes to us, their morphology, the individual organisms are lancet shapes which are arranged in the forms of pairs, that is, the diplococci, or sometimes into the short chains. These are capsulated, having a no motility, and they are the non-spore forming bacteria. When we stain them through gram staining, they are the gram positive or appear the violet in color. We can culture these diplococci or the Streptococcus pneumoniae onto the blood agar and chocolate agar, where they produce the small raised entire edge and round colonies, which are alpha hemolytic onto the blood agar. We can see the effect of the capsular polysaccharide. The most of the pneumococci are polysaccharide producing and give rise to the smooth colonies. A few are unable to produce capsular polysaccharide and give rise to the rough colonies. When uncapsulated, pneumococci are cultured in the presence of DNA extracted from a capsulated pneumococcus. Encapsulated pneumococci of later types are formed, and this process is called the transformation. Pneumococcal colonies are sensitive to lysis by an autolytic enzyme L-alanine muromyryl amidase that cleaves bond linkage L-alanine peptidase to muromeric acid of peptidoglycan wall. This enzyme is activated after the culture enters into the stationary phase and growth and will in time cause the lysis of entire culture. The Streptococcus pneumoniae are the aerobic or facultative and aerobe. They ferment glucose, produce the lactic acid but not gas. Lactic acid limits the growth. Now we comes to us the differential points between the pneumococci and the Streptococcus viridans. The pneumococci are capsulated, while viridans streptococci are non-capsulated. Streptococcus pneumoniae lies spontaneously into the media, while Streptococcus viridans don't. Streptococcus pneumoniae are lysed by the oxyl bile 10% or sodium deoxylate, while Streptococcus viridans not. The growth of the Streptococcus pneumoniae inhibit around the oxygen disk, while Streptococcus viridans growth not. And these are the differential points. They have the different types of the antigens in themselves, like the capsular polysaccharide antigens, and these are distinct for each of the 84 serological types. Virulence is due to the capsule, which protect it from the phagocytosis, and the other point of this capsular polysaccharide is to elicit the B cell responses, which provides the type specific immunity. They also have the M protein and C carbohydrates and IgA protease in themselves. Different types of toxins they produce, and the most important are the immunolysin, which binds to the cholesterol into the host cell membrane and inhibits the antimicrobial properties of the neutrophils and cause the opsonic effects. These are the normal inhabitants of the upper respiratory tracts and can transmit via the respiratory droplets and cause the different types of diseases later on. First, they cause the pneumococcal or lobar pneumonia. The pneumococci produce the diseases through their ability to multiply in tissues, and its virulence is determined by the capsule, which prevents or delays the ingestion of encapsulated cells by phagocytosis. The loss of natural resistance is due to the abnormality of respiratory tracts, that is, the viral infection, allergic asthma, or alcohol or drug intoxication that depress the phagocytic activity and cough reflex. Pneumonia is characterized by the exudation of fibrinous edema fluid into the alveoli, followed by the RBCs and leukocytes, with many pneumococci also present into the alveoli. This causes the consolidation of the portion of the lungs, later mononuclear cells, activity phagocytose, the depress and pneumococci, and this liquid phase is gradually reabsorbed. Different types of serotypes are involved in causing the lobar pneumonia. The type 1 to 8 are involved in causing the disease in adults, and type 6, 14, 19, and 23 in children. There are some differential point between the lobar pneumonia and bronchial pneumonia. We can see that lobar pneumonia is caused by the 90% by pneumococci, or a few cases by the Klebsiella pneumoniae or Staphylococcus aureus, where the bronchopneumonia is caused by the Staphylococci, Streptococcus, Haemophilus influenza, Proteus, and Pseudomonas. The lobar pneumonia occurs in otherwise healthy individuals between 30 to 15 years of age, while the bronchopneumonia occurs in infants or old people. The onset of lobar pneumonia is sudden with high-grade fever and shaking chills and bloody or rusty sputum, while the bronchopneumonia onset is insidious with low-grade fever and cough productive of purulent sputum. The complications are the bacteremia, meningitis, endocarditis, and septic arthritis seen into the lobar pneumonia, where in the bronchopneumonia we can see the fibrosis, bronchiectasis, and lung abscesses. Clinical findings are sudden onset of high fever with violent shaking chills, sharp pleural pain, and friction in rub, cough, and firstly dry and then productive, seen into the pneumococcal pneumonia, and spontaneous recovery between 5th and 10th days associated with development of type specific antibodies. Streptococcus pneumoniae also cause the bacteremia and its complication. From alveolar exudate, organism reach the bloodstream via lymphatics and cause the bacteremia, which have a triad of serious complication. The number one is meningitis, 2 endocarditis, and number 3 is septic arthritis. Other complications include the sinusitis, otitis media, pericarditis, empyema, and septicemia. Streptococcus pneumoniae, or the pneumococcus, is the second common bacterial pathogen that causes the meningitis in adults. The pathogen is that it may arise as a complication of pneumonia in which pneumococci reach the meninges by way of bloodstream, and it may result from a skull fracture, permitting pneumococci from nasopharynx to enter the meninges and causes the meningitis. So the pneumococci is the second common bacterial pathogen that causes the meningitis in adults, which is a serious complication caused by the Streptococcus pneumoniae in adults. And other pneumococcal disease is the etiological agent of about 50% cases of otitis media in the children. Important serotypes involved in the otitis media are the type 6, 14, 19, and 23. Different types of laboratory tests are being performed for their diagnosis. Blood, sputum, pus, CSF are the specimen of choice. Gram-strained smear of rusty sputum seen under microscope, and we can see the gram-positive diplococci, neutrophil, and RBCs. Capsules can be demonstrated by the necrosine staining or India ink preparation. We can culture the specimen onto the blood agar and chocolate agar for the further diagnosis and for the detection of the pneumococci, where they produce the different types of colonies, which are the differential point for their diagnostic procedures through the culture. Capsular swelling test, or the quilling test, in which the fresh emulsified sputum or suspect of the pneumococcal pneumonia is mixed with the specific anti-capsular polysaccharide antibodies, or the polyvalent anti-sera, is usually used. The capsule swell markedly it means that the test is positive. Omni antiserums contains the antibodies against all serotypes, which provides a definitive identification of pneumococci in this specimen. We can also use the different types of optogen disc test in which differentiate between the alpha hemolytic pneumococci and alpha hemolytic streptococci or Streptococcus viridans are differentiated. Pneumococci are very sensitive to it and so will fail to grow in its proximity, whereas viridans are insensitive and will grow adjacent to implanted disc. So the pneumococci are sensitive to optogen disc, while the viridans streptococci are not sensitive and produce the colonies around the optogen disc, which is the differential test for the Streptococcus pneumoniae and Viridin streptococci. Optogen discs are laid down on agar plate surface which is inoculated with unknown organism. Other test is animal inoculation test, in which sputum is peritoneally injected into the laboratory mice. If mice dies within 18 to 40 hours, it is very sensitive to pneumococci. Heart blood gives the pure culture of pneumococci. Pneumonia prevention includes the following, that is vaccination, practicing good hygiene, avoiding aspiration, addressing the environmental factors and reduce the exposure to indoor pollution, adequate nutrition, improving the housing condition and avoiding the smoking near the children. If you like our video, please like it, subscribe the channel and also bell icon button.